Good morning friends. This is a video of treatment of PID with sciatica with pain portal blocks and extracorporeal blood oxygen ozonization. This is the pre-treatment MRI of the patient and he has been treated with pain portal blocks and pure glass non-plastic renal filter EBOO system. Effects of real EBOO. EBOO does not involve filtration. Filtration and plasmapheresis is an entirely different procedure altogether. This video shows step-by-step procedure with pre-therapy and post-therapy movements, pictures and videos. This was a patient with a sciatic scoliosis, severe pain, came in walking limping, needed support of a friend to walk in. The SLR was restricted on both sides. On the right side he had about 100 degrees. On the left side he is not able to raise beyond 40 degrees. We now mix xylocaine 0.2% small quantity, about 1 or 2 ml. Then we mix 5 milligram of depomedrol. We mix 30 micrograms of clonidine and then we dilute it with water for injection, about 7 to 8 ml. We have to ensure that the lignocaine or xylocaine is diluted at 0.5%. Low dilutions, more safety, no anaphylaxis and better results, longer lasting. Next is mixture of hydrozone. First of all, we clean the spots where we plan to inject. The ankle spots are beta 1, beta 2, beta 3. The calf spot is beta 5. The trunk spots are tau 1 and tau 4 and tau 5 at the sacroiliac joint. We now take the cocktail and we are injecting, that's beta 1 laterally sinus tarsi. Next, through the same pore, same needle, we will inject ozone 1 cc. Below lateral malleus is beta 2, 1 cc of the cocktail and just 1 cc of ozone. We have to use the same needle all the time, retain all sterile precautions. Beta 3 is under the medial malleolus, again 1 cc of cocktail and 1 cc of ozone is injected. We have to remove the needle after injection of the ozone. The same procedure is repeated on the opposite side, 1 cc of cocktail and 1 cc of ozone into every portal. Beta 1, beta 2 and beta 3 bilaterally. And after this we will give in the trunk, which is tau 4 block, that's tau 4 left side and tau 4 right side. This is given bilaterally. The discomfort is minimal and the entire procedure takes less than 5 minutes to do. While the cocktail in ozone takes time to have its effect, we will begin with the procedure of EBOO. This patient has a large sequestrated disc, diminished SLR, difficulty in walking, occasional urinary incontinence, and has been advised surgery by 4 neurosurgeons and 1 orthopedic surgeon. We take 3.5 ml of 5000 units per ml heparin and inject it into a saline bottle. The needle is retained in the saline bottle, which will act as an air vent. The remaining 1.5 ml of heparin at 5000 units per ml, that is 7500 units, is now diluted with 5 ml of water for injection and is kept safely for flushing of the syringe if needed. This syringe is normally used to flush either the donor or recipient sites if they get clogged or blocked. This is our IAOS Glass EBOO bottle. We open up the top lid to ensure that the small circle, the big circle, and the plus marks are clearly visible. Artery forceps is pushed into both large circle and small circle to ensure that our donor spikes and the waste spike enter easily. The waste spike is now put into the small circle. The artery forceps had made our job easier. Ozone is now inserted into the needle. The ozone needle is now inserted into the plus mark. We have to make sure that the needle is into the middle of the stainless steel tube, and while shaking the needle, the stainless steel tube shakes. After that, we will prime the set. The bottom part is opened and the big circle is identified where we will be pushing the recipient set. The aluminum foil of the recipient side is opened a little to facilitate the later pushing of the recipient set. The ozone needle tube is now attached to the ozone machine, and now we open the set, donor set, push the heparin part, prime it, and then ensure that the entire interior of the tubings are primed with the dilute anticoagulated solution. Once the tube is primed, we close the heparin, attach the tube into the perfusion pump. This is a very high quality perfusion pump with 0.1 milligram flow. The steel spike is inserted into the larger hole, which was enlarged by an artery forceps not so long ago. You must ensure that the steel spike is at a much lower level than the waste spike. The tubings are now held, the perfusion pump is locked in place, and we check if the fluid is moving and is going into the bottle and dropping it drop by drop. We can see that the dilute heparin is coming into the bottle drop by drop. We switch off the pump, we are ready for our procedure. The recipient tube is pushed into the lower side, into the bottom part of the flask, and kept locked and closed, which we will only open at a later stage when we are doing the recipient side. Only after all connections are made should one attempt to begin the donor vein cannulation. A tourniquet is applied, the donor vein is identified, an 18G venflon, a small one, is used. We can even use a 19G butterfly or a venflon. Below 19G may not be advisable. The venflon is pushed in fully and the donor tube is connected. The pump heparin is started very slowly, and the pump is started to start the inflow of blood mixed with heparin into the bottle. Here it does not matter even if air enters, because the recipient site will be gravity modulated. Once enough solution has reached the bottom of the bottle so that the diffuser is immersed, we start bubbling of ozone, and the moment the blood enters the bottle, there will be no ozone smell in the room, as entering blood absorbs the entire amount of ozone. It is very important to note that no ozone destroyers are used in the process, and thus we are able to quantify the exact amount of ozone that has been perfused in the blood. Ultraviolet lights are switched off. The patient and the staff wear protective goggles. Once half the bottle is full and ozonized, we prime the recipient set, and now we can prime the recipient set fully. We can see the blood coming out of the recipient set is brilliantly bright tomato red compared to the venous blood from the other side. Recipient site can be around the wrist area, and again an 18G venflon is used. For recipient site, even a 20G venflon is sufficient. The recipient site is now connected, and now is an important step. We have to ensure that the donor and recipient flows are identical and that the bottle remains at 50% capacity at all the time. We can clearly see the color difference between the donor and recipient site. The donor site venous blood is dark purple, whereas the recipient site blood is more flushed and red than the arterial blood and is almost tomato red in color. This color difference is not because of any plastic or renal filters, but is entirely due to ozonization of the blood. Here we are giving 100,000 micrograms every 8 minutes. Means in 32 minutes we will be giving 400,000 micrograms. In 40 minutes we will be giving 500,000 micrograms. Effects of blocks have already started coming, and the patient is able to raise his legs much higher without any pain. The procedure takes exactly 32 to 40 minutes, and we can see the characteristic difference between the donor and the recipient bloods in the system. The entire system is extremely simple, easy to use, reproducible, teachable and trainable. We can see the blood inflow from the donor side going into the perfusion pump. From the perfusion pump it goes into the glass bottle, and you can see the color of the blood and how dramatically it changes. We have concluded 40 minutes of the procedure, which is 500,000 micrograms of ozone, quantifiable, bubbled into the blood. We are not filtering normal blood or throwing away plasma as waste and calling it hemofiltration with incidental ozonization. This is the pure EBOO. Once our donor site has done 40 minutes, we remove the donor connections, lock the Venflon, restart the machine and increase the speed so that the blood flows from the empty tube, from the tube, emptying it and flows into the bottle. It must be remembered that despite passage of 40 minutes, ozone has not been stopped, it is continuously bubbling and will continuously bubble till the end of the procedure. We now lock the system, remove the tubings, detach the heparin and use the blood flow tubing also as a waste tubing. The froth containing the oxidized paste, which is very low in quantity, flows into the bottle. We can now increase the flow of the blood, and once the bottle is empty, only then we switch off the ozone flow. Once the blood has flown to the heart level, we can close the blood flow, put the chair to a reclining position and the procedure is complete. The recipient site is disconnected, a stopper is put. As we plan to give hydrogen infusion to the patient on the next day, we will inject some anticoagulation into the left side and this vein shall be kept patent, whereas on the right side we will remove the bandages and give him a straight padding, asking him to not remove it for a week. This is the video that the patient sends to me after 6 days. When he reaches home, he is completely comfortable, pain-free and happy. For further details about how the procedure is done and any other details about portal blocks, ozone or EBOO, feel free to contact me at the above number. Only messages, please no calls. Thank you and have a nice day. Thank you.